The testing and treatment for hypothyroidism patients is the same regardless of underlying cause. You want to be treated based on your individual lab work. You need full thyroid panels, and other labs are important to understand what's going on in the body as a whole. And your medication should be dosed based on your full thyroid panel. And I recommend combination T4, T3 treatment, where you get some active thyroid hormone with inactive thyroid hormone, and you're not relying as heavily on conversion of T4 to T3, which the majority of us with hypothyroidism do not convert T4 to T3 well. And all of my patients with hypothyroidism are on combination treatment if they need medication. None of my patients are on T4 only. And I believe strongly that T4 only treatment is problematic. Now, with that said, when it comes to underlying causes, the only difference is those of us who have had a thyroidectomy, which I had a thyroidectomy due to thyroid cancer, and for people who have had RAI, or the thyroid has completely atrophied, or the patient was born with congenital hypothyroidism, we are solely reliant on thyroid hormone replacement for metabolism regulation. We have no way to produce thyroid hormones, and there is no natural remedy. So anybody out there promoting that you don't need thyroid medication, that is dangerous advice, especially for those of us who cannot produce any thyroid hormones at all. We can slip into a coma and we will no longer exist if we do not take our thyroid medication, because we have to be able to regulate metabolism. Now, many people with a functioning thyroid have damage to the thyroid, have other issues where they simply don't produce enough thyroid hormones, or they do not convert T4 to T3 well. They are also reliant on thyroid medication for life. There is a small percentage of people with hypothyroidism who can treat the underlying cause and reverse their hypothyroidism holistically. But I will tell you that in my practice, this is quite rare. It takes a lot of effort. It takes a lot of work and monitoring, and it is not something that can be achieved by every patient, because we don't always know if there is damage to the thyroid. We don't know sometimes what the cause of the dysfunction is. And if you are going to treat holistically and you do have a functioning thyroid, you have to be closely monitored and understand that it may or may not work for you. But the only difference is some of us have zero way to produce thyroid hormones, and some people with a functioning thyroid with hypothyroidism simply do not produce enough thyroid hormones, or they do not convert T4 to T3 well. At the end of the day, we all need proper testing, we all need proper monitoring, and we all need proper treatment. And the other labs outside of a thyroid panel are important, because hypothyroidism can trigger many things in the body, and many things within the body trigger Hashimoto's, trigger hypothyroidism. And so you want to make sure that at least with an initial consultation, you are getting comprehensive labs to understand what's going on in the body as a whole, what needs to be treated. And thyroid medication by itself, not helpful. I believe strongly that you need holistic care with thyroid medication to feel good. Vitamin and mineral support, gut liver support, and all of that is dependent on your individual lab work as well.